I am co-facilitating this session today with one of my colleagues, Carlotta Basualdo Hammond, and we are pleased to welcome you to our session on room service. And we want to extend a thank you to our panelists who are here today to share their knowledge with us. So the purpose of the session really is to just learn from people who have gone before us. Many of you on the line may be interested in understanding room service. These are things perhaps that you have read about, you've talked about somewhat informally, but this is an opportunity for us to ask people who have gone before us and have had success with implementations at one or more of their sites within their organization, some burning questions around room service and how it's working for them. Through your participation in today's session, you will receive information really in two ways. First is the survey. So hopefully everyone on the line will have received a pre-circulated high-level summary of the results of a survey that we administered a few months back. And secondly, as mentioned, we do have, well, we'll say 4 panelists. We have 3 in attendance and one who graciously sent us in written responses to our questions. And we'll be able to learn from their experience today. We did want to maximize the time that we have available. We have an hour, so we've pre-circulated 7 questions to our panelists, and these were questions that were really challenging to answer in a survey. They weren't really a numerical answer or a yes or no answer. They were things that required a little bit more explanation. So we hope that the questions that we have identified and have pre-circulated and we'll be focusing on today will help you answer some questions you have. However, there is also a comment box or a chat box, and so if something that is said triggers another question, or if you have a question, please go ahead and put it in the chat box. We will do our best throughout the course of the hour to answer those questions, and if we are unable to answer them due to time, we will keep track of them and formulate sort of a collated response to those that we can send out later. Some housekeeping items before we get started. Thank you to everyone just for muting. I know sometimes we forget that we're not on mute, but it just does help to reduce that background noise. And also, we wanted to disclose that this session is being recorded. And Haley, can I confirm that with you? Okay. Thumbs up. So the session's recorded. If you had a colleague who wanted to attend, or if you want to go back and listen to it again, perhaps you've missed something, the session would be available on the Nourish website. Okay. All right, so with that, I just realized that I didn't advance my slides, so we're going to go ahead and do that. We did pre-circulate some information. As I said, we had sent out a survey about room service asking questions related to what are your hours of operation? What do your menus look like? Are they paper menus? Are they electronic? Questions that were somewhat easy to answer in that format, and we sent it out to individuals we knew had room service. So only 6 were completed, but we did get responses from organizations within Alberta, British Columbia, Ontario, Nova Scotia, and Quebec. And so of the 6 who responded, we do have 3 of those individuals as our panel members, and we're going to get to them in just a second. You will have also received this highlight. We do and are able to provide you with a copy, a complete copy of the survey results. We didn't want to inundate you with that much information before we met, but should you be interested in receiving the full survey results, please let me know. I'll provide my email information at the end of the presentation. You can just shoot me an email and I'd be happy to share that with you. One of the things we did notice when we went through the results were that overall there were a lot of similarities amongst the 6 sites who responded, but there were also some differences as well. And so some of the things that we found that were similar were the motivations for room service, what people hope to achieve by implementing room service, the fact that most sites use the fixed menu, with the exception of one, most sites offer daytime service. One is working 24/7. And let's see here, and most use a combination of from scratch, and some continue to use some prepared items. Some of the differences that we noticed from these sites were really how the orders were received. Everything varied from bedside ambassadors to a phone-in service to a call center, and also some of the sites are using room service as well to provide snacks between meals, which we thought was an interesting way of providing those between meal nourishments. So we appreciate this is high level, and as stated, happy to provide you with something that has a little bit more detail following this presentation. Right. So I'm going to pass it over to my colleague, Carlotta, and she's going to go ahead and introduce our panel. How we plan to facilitate this session, we'll be taking turns, we'll ask questions, and then we'll provide our panel members an opportunity to respond to those questions. I'll do my best. I don't see the chat box at this because I have my screen on sharing the slideshow. So if someone, Haley, do you mind if there's a comment just to sort of give me a heads up? Okay, appreciate that. All right, Carlotta, over to you.
Great, thank you, Danielle. Can everyone hear me okay?
Yes.
Okay, so we're really excited to have our panel. So we have 4 of the 6 sites who participated in the survey represented. We have Andrea Connell from IWK Nova Scotia. And actually, one thing interesting with the survey is there's a predominant of pediatric facilities and responses, but we do have a mix from the speakers today. So IWK being more focused on pediatric, but for Nova Scotia, I think you can speak more, Andrew, around this. I think you're looking more broadly around the Dial for Dining program more broadly within Nova Scotia. And then we had a respondent for our survey, our cohort member, Michelle Nelson, who responded. She wasn't able to be here today, so in place of her, we have Carol Lajoie, who is going to speak about the Covenant Cuisine, and pleased to have Jose Lavoie as well from our group, and obviously from CHUV Saint Justine, so again, more pediatric focused facility to speak. And thank you so much, Jose, for speaking in English. I know, Haley, you'll help if we need some translation, because it's amazing to me that you're going to try to speak in English for us today. Thank you. And Marianne Kusin from Halton Healthcare in Ontario wasn't able to be here, so she has provided responses to some of the questions that we had, and we'll just be highlighting her key responses on her behalf today. Okay, so we'll get started. We wanted to go fairly quickly through the questions and to really give some opportunity as well for further questions and discussion at the end. So the first question is, what or who created the sense of urgency to initiate room service at your site? And so our plan is to have each of the panel members answer this question, and then I'll share Marianne's response to this question, and then we'll move on to the next questions. So we'll see how that goes. So I don't know if we want to go in order, Andrea, Carol, Jose, and then I'll do Marianne.
Sure, I don't mind starting. It's Andrea from IWK Nova Scotia. So I have to say that we started Dial for Dining in 2008 for the room service model. And it was really driven by a lady who was here before me, thank goodness. We wanted to improve patient satisfaction and improve patient plate waste because our waste was quite high. So we end up really getting over 50% of our meals returned from our traditional tray line room service model. So we wanted to improve that drastically and really improve the nourishment of our patient population. And as well, we knew that we could better utilize our staff and put them in better places. So we actually transitioned to Dial for Dining room service in 2008, and it's been incredibly successful with a decrease of quite high in percentage of plate waste, and we now have less than 5%. So it's been very successful.
Okay, well, it's Carol here from the Misericordia Hospital in Edmonton. Again, this was an initiative, the whole concept of room service, something that our team had looked at here for a number of years and wanted to implement. So really it was something that had been on the back burner, and the opportunity came when our very antique piece of equipment called the tray-veyor that was taking our trays from the kitchen up to the floor, so it's basically a dumbwaiter, was in desperate need of repair, and it was going to cost over 1.2 million to replace that piece of equipment, and we knew that we would have to go on a waiting list, et cetera, et cetera. So it really gave us the opportunity to say, hey, if we're going to move to taking our meals up on carts, what's a better way we could do this? And again, just as Andrea spoke about, we weren't happy with our plate waste, we weren't happy with our patient satisfaction scores. So it was kind of a melding of all of those things coming together and an opportunity for us to improve how we were doing everything. And we just went live in May, by the way.
Okay, it's José Lavoie from Saint-Justine. Alors for us, the sense of urgency came from several things. The first one was that we had a new construction in the hospital, and it's mean for us that kids will be more far from us. So it's mean more time to deliver meal. And for us, and also the other thing, it was we stay in the whole part of the hospital, and the kitchen never had the renovation. So it's mean that it was 1955 years kitchen. So it was beautiful, but really old. And after that, we had also a poor satisfaction survey. We were at 60% of satisfaction, and we had a lot of waste. So 25% of our plate come back untouched at the beginning of that. So it was meant for us that we had to find another way to serve patients, to be sure that we could be more related to the patient and in direct connection to them. And in the hospital, the humanist way was something important. What I mean by that is in hospital, the patient lose a lot of control. So for us, it was important to find a way that the kids or the mother could have control of something. So we did a visit from other hospitals. We did research, on the web to know what kind of type of service existing that we could use. And the room service became for us the better things for our patient. So we had to present that to the direction. We talk a lot with healthcare department, nurse, prep, and doctor, just to be sure that it's something good for kids or mother, because we have adult too here. So the room service was for us the best solution, and the hospital find that too. So it was the reason why. If it's not clear because of my English, please ask question, and I will try to explain it in a better way.
Jose, that was really clear. Thank you. And so with Marianne, she had a lot of the similar reasons for wanting to move forward with room service, including that it's really patient-centered, so similar to what you were saying, Jose, around wanting to have something that people have control over. So the patient-centered model, the innovation, and all these benefits made them look towards room service. But in addition, a new facility was being planned, and wanting to move forward with room service in that new facility, they decided to actually start room service in their old hospital and get it going, so they were going to know that they would be successful in room service in their new build.
Okay, great. Thanks, everyone. So we're going to go on to question 2. Carlotta, were there any questions in the comment box?
Not seeing any, nope.
Okay, great. All right, thank you. So we'll go on to our next slide. So we'll do the same order. We'll start with Andrea. So what were the most significant selling points for room service for the different groups? So if you could speak to how you sold it to leadership, physicians, the care team staff, your own nutrition food service staff, etc.
So again, it wasn't me who did the implementation, but assisted with the implementation. So I'll try to speak to this as best as possible. But I think a lot of us will probably say that the cost savings was a big one for leadership, as well as improving patient satisfaction and overall improving patient outcomes with their recovery times. And I think now it's more important than ever with malnourishment and malnutrition and early recovery after surgery initiatives that are coming out. So just reiterating the positives. So again, the cost savings as well as the patient satisfaction was really huge for us.
Couldn't find the mute button, sorry, thank you. Carol? Carol, you might be on mute.
There we go. There, can you hear me now?
Yes,
sorry, I was controlling it from our clock here. My apologies.
That's no problem, go ahead.
I agree with everything that Andrea said, and obviously when we were presenting it to senior leadership, you're looking at your key performance indicators. How can we, our goal was to do a cost neutral implementation, as well as increasing our plate waste, our patient satisfaction scores, etc. But I really found when we were rolling the project out, bringing people like the physicians, the care team staff, our staff in, we went with a much more soft sell that I found effective, and really talking about what's it like to be a patient in our facility. We talked about, just as Jose had said, that lack of control that you have, the fact that food becomes really important, often emotionally to your healing process, and talked about sort of the, that support that, if you've had, say you're struggling from cancer and you don't feel like eating at 8 a.m., but now it's 10 and you do feel like eating, and it's really important to have that food as part of your healing process. That ability to get what you want when you want it is really key. And we found that soft sell, people could really relate to that. And once you talked about it at that level, the frontline staff, the physicians, everybody got it right away and was very quickly on board and supportive of the concept.
Thank you. And Jose?
Okay, here when we start the discussion, we talk with director first. We have a council or with all the director there, and for them, three things. I think that the control was really important. Satisfaction. So control for me, it's also like human, it's something, it's in French, we said humanist. I don't know if it's the same in English, but it was really important here for that. Also satisfaction, and money is also an issue. For us, all the analyze we did with all type of service that we could do to a patient, the room service give us to save money. So it was good for director. When we talk to a nurse, we talk with nutrition or the employee, everybody was really agree with the fact that kids could choose. It's true that it's not everybody who are angry at the same hour. And the food service, the room service give us this opportunity. So everybody was agree and happy about that. So for our staff in the kitchen, they wanted that service because of that. We are all here to feed patient. So it's I have the word funny, but it's happy for us to see plate coming back empty, because for us it's mean that kids have eat, and it's what we want. So it was really a selling point.
Excellent, thank you. I see that there might be a question in the question. Carlotta, can you?
Why don't we respond, give Mary Ann's, and then I'll add the question.
Okay, sounds good, thank you. So I think, again, a lot of similarities in what Mary Ann showed. They certainly sold the fact that there would be a decrease in waste. They were sitting between 30 to 40% that were coming back untouched. Also, their satisfaction surveys were showing a high level of dissatisfaction. And so, like the others on the panel, she certainly reinforces that this provides an opportunity for patients to choose. I think because it was a new facility or a new hospital, that provided an opportunity to introduce a new meal delivery model. They did feel like there was a significantly lower cost per patient meal with the room service model, considering that the likelihood is that patients will eat only what they want to eat. And then she also indicated that they found it to be an efficient service. And so a lot of similarities, again, across the board. And I think there's definitely some good feedback. Everyone certainly spoke to what was referred to as the soft sell, which is the human side, and the fact that being in a hospital is challenging. Okay, so with that, we will go to the question.
The question is, can any of the panel highlight the percentage of cost savings they would have realized? And I wonder if we could have the panelists speak to this question towards the end, where we ask about the approach to evaluation and data capture pre and post. We'll make sure, I think, to cover the cost question at that point.
I think that's a great idea. So we'll just put that on hold for now, but we'll definitely come back to it. All right, Carlotta, question number 3 is over to you.
Okay, you're going to move the slide, right? So the next question is, who were the most challenging stakeholders to engage? Why were they challenging, and how did you manage this? And I guess we can start with Andrea again.
So I'm actually going to defer this question, where it was mainly the previous manager who dealt with this. So we'll see what the other lovely Delaware County or room service representatives have to say.
Carol, and it was recent with your stakeholder engagement, so probably some fresh thoughts.
Yeah, very fresh. I would say probably we had 2 different challenges, and the one was with nursing, and it wasn't that they weren't very supportive of the concept, but very concerned about how it would disrupt their daily activities and their daily work routine. We had the help of our project management office, and we brought together representatives from across all the care staff, so not just nursing, but we had lab DI, the therapies were there, clinical nutrition was involved, and we really involved them directly in developing policies and procedures around ensuring, for example, that meds that needed to be taken before meals, how are we going to manage that? How are we going to ensure that a diabetic that needed insulin with their meal was getting that? And I'll be honest, there was a lot of angst amongst the care staff before we went live, and pharmacy, as to how that was all going to be managed. The consultants that we had engaged had made it really clear to us that the reality is that most people will order at their regular meal times anyways, and we have found that to almost be true to a fault, in that everybody wants breakfast at 8, everybody wants lunch at noon, and everybody wants supper at 5:30. And so what's become a bigger issue for us from a operational perspective is trying to get through those peak periods when everybody's ordering. And the feedback we've had from the care staff is this hasn't impacted their work routines at all at the end of the day. Keep in mind, we have all adult population here. There are no pediatrics at this facility, and the majority of our patients, I would say, would be seniors on most of our units. I would also say the other group we struggled with was the union, and not so much our staff, just a core group of staff, and the union really took that and got a hold of it. But my personal opinion is it's the particular union we're dealing with at this site. I don't think, knowing sort of my past experience at other facilities and that we would necessarily have that same experience. And I think it's just our leadership here and sort of how some of the things were rolled out and handled through our HR team. So again, my advice I'm not sure I would have done a whole lot different with our union other than being very upfront at the beginning as to the kind of changes we were making. I think we probably needed to have it very clear ahead of time from everybody as to how the changes in job routines, et cetera, were going to be rolled out. And we worked really hard to try to have that in place. And unfortunately, as everybody knows with projects, not everything always goes the way you would like it to, and you don't have control over everything. So we worked with it, and I think everybody has settled since implementation.
Okay, thanks, Carol.
For us, I would say that I think everybody was preoccupied about something. If we start about nursing, they were really concerned about the fact that in the past, everybody received a meal at the same time. So for nurse, it was easy to know everybody received a meal. But now they have to call to receive the meal. So they was really preoccupied about the fact, how could I know if the patient receives something or orders something? So we developed for them a report that they receive meal after meal. I think what it was important for us, it was to meet everybody, to take the preoccupation, and after that, try to find solution for them, just to show them that it's not something negative for them, but it's something positive. So we develop a report for them that they receive 3 times a day, where they see who were supposed to eat and didn't order something. So it was easier for them to do follow-up with them. With dietitian, the concern was about 2 things: the respect of the diet, and to be sure that they eat a good meal, something complete with all the 4 groups and everything. So for the diet, we still use the same informatics system. So it's mean that when the diet technician take the call to prepare the meal, we were sure that the diet is respect, because we use the same system. So for that, it was easy for them to understand that. And about the full meal, we had to explain to dietitian that actually some kids receive a meal and they don't eat it. So if they don't eat it, it's means that they don't receive what they are supposed to receive. So we put rule inside the way that we take the order, to be sure that, okay, you don't want to eat a made meal now, we take a note, and if you do that 3 times, we advise the dietitian, he can see the patient after that. Is it clear what I'm trying to say? Yeah, okay. It's good to have some person who did yes with his head. It's good. And we also met our employee was really concerned about the fact to see kids, because for us in the past, we deliver meal, but we stop at the office of the department, and it was the responsibility of the nursing to deliver the meal. But for us, it was important to deliver to the patient, because we were concerned about the fact that it's arrived the faster we could. So it's mean faster hot, better in the temperature of the meal. So our patient was really, our employee was preoccupied by the relation they had to develop with the kid. But we give them rule, we ask to nursing to come to talk with our employee, just because we want to train them how they have to be with the kids, with the patient. So we do that for the employee, and for physiotherapist, inhalotherapist, all the people who works with the patient. For them, they had to talk with kids, you know, because I know that some of those persons told us, yes, but if I have to see the kids at 9 a.m. and he ordered the meal, what could I do? So we said to those people, you have to talk with kids. You have to plan your appointment. You have to give them the information just to be sure that when you arrive, he is there or she's there for you. So what we do a lot before the implantation, it was to talk with those people. So we met them several times just to be sure that we could answer to their preoccupation, and also to give them the good things of the room service for their patient. That's it.
Thanks, Jose. Really good description on the different types of engagement that you had to do. And for Marianne, she didn't really identify a specific challenge, but more articulated that they really had to plan communication specifically for each of the different stakeholder groups who were involved with trade delivery and meals and so on. And so the group is really multifaceted. So I think a key message I took from her response was really thinking broadly around all the different stakeholder groups and targeting the messages specifically for those groups, and targeting messages around clinical dietitians with planning and communication on the unit, understanding that patients are now being introduced to this new model via note cards on trays. So what is the communication for patients, and as well communication and education for food service on the units. And they did things called unit huddles and so on. So similar messages to the others around really targeted messages and understanding the needs of the different stakeholder groups.
All right, great. Thank you. We'll go on to question number 4. So here we wanted to know whether or not you used a staggered implementation approach, or did you do it all at once? And so, Andrea, I'd like to tackle this question.
Sorry, trying to find the mute button there as well. Trying to think back if we used a staggered approach as well. I believe we did it all at once. I'm actually curious to hear if anyone did a staggered approach on the panel.
Hi, it's Carol. No, we did it all at once. That being said, we are running 3 units still on a pod system. So they're on a standard tray. And then we have our assembly line that's specific for our room service.
For us, we start all the hospital at the same time. It was not an option for us to do it step by step, because it was a human, we were not able to do that in the kitchen. So we had to do one or the other. So we decided to do one shot deal. And I think it was the best.
Yes, Jose, I have to say, it's just Andrew again. She's right. We had to do one or the other as well, because we completely got rid of our belt line and completely transitioned to an entire new menu. So it did have to be implemented all at once.
And Andrea, just a quick follow-up question to you. Did you do all the hospitals across the province at once, or was that sort of, did one learn from the other?
So IWK at the time of when it was implemented was with the rest of the province and the hospital. So we were with the other DHAs, but it was actually done separately. And right now, the rest of the hospitals in Nova Scotia are actually starting to implement it. Some of the sites have room service implemented, but not fully. So they might be operating the room service or dial for dining by, letting them choose certain items for breakfast, but not for lunch. So it's not fully transitioned. So they're working on fully transitioning the sites now.
Great, thank you. All right, so I'll go to Marianne. So actually, it looks like they did an 8-week trial on 2 of their units to start, maternity unit and pediatrics, and then they moved to the remainder of the units after that. So she didn't, not really much more to say on that, but I do see a question has popped up. Is it one that we can address now, Carlotta? Or?
Did patient satisfaction improve, and by how much? And again, I think we should talk about the evaluation. We'll need to make sure we have time for the evaluation discussion.
Well, we will. It's one of the questions, so we'll definitely get to that. So,
yeah.
Okay, great.
Okay, so the next question is, did you or do you currently run more than one meal delivery system to meet your patient needs? So is there room service plus other systems, or is really the service for everybody room service? And so, Andrea?
So again, right now we currently just do the dial for dining room service model. For anyone who's on a clear fluid or full fluid, however, we do send those just as standard meal trays 3 times a day. So for breakfast, lunch, and dinner. And then if someone comes off clear fluids or full fluids, they can order an additional dial for dining meal as well. So that's our current delivery system. We use black carts. Our kitchen's actually located in the basement, and we deliver to 2 different sections of the hospital. So one side of the hospital is for maternity, and the other side is for pediatrics. And we've got about, let's see, 6, 7, we've got about 5 different units and floors that we deliver to, and deliver the meals within 40 minutes. And that's the same with the full fluids and clear fluids as well. So our standard trays, they get delivered at the same time every day. So the patient doesn't get to call down and order their clear fluid or full fluid, but it's sent automatically as part of recovery.
Thanks, Carol.
Can you hear me?
Yeah, we can hear you.
Okay, there you go. Okay. So yeah, as I mentioned before, we actually have 4 units that we've left on our standard service. So emergency, our alternate level of care and geriatric assessment units, and our mental health unit. That being said, that's one of the things, again, we've only been live since May, and we are going to reassess. Emergency, we will probably leave on a standard tray, but we are going to reassess those other units. And then we do provide standard trays, again, the clear full fluid are standards. And if we have a patient on one of our other units who doesn't have the cognitive ability to make the phone call, doesn't have family support to do pre-orders, yeah, and we're simply not able to provide that service, then we put them on a standard tray as well.
Great, thanks.
For us, the emergency receive a meal pre-schedule, but the pre-schedule about what they will receive, but the emergency ask us when they want it. So they decide the time, but we decide what they have in the plate. For the kids who are anorexia, bulimia, they receive a regular meal at a specific hour because it's for the treatment of those kids. And we have psychiatric kids who eat like a buffet. It's also for it's what the departments want. But all the rest of the hospital, so it's mean for us, maybe 90% of the hospital are in room service. And we also give the possibility to the parent to order also like the kids in room service, and they pay for it.
Great, thanks, Jose. And so for Marianne, Again, this is a mixed facility, and they are running a variety of different models. So room service, which is called call to order, is really one of their services that they offer at that site. And so some of the other areas like mental health have a dining room service. In their complex traditional care, they have a bedside meal select in the day in advance. And they have a hostess meal delivery at meal times in one of their areas, and then a centralized tray pod for those who aren't able to participate in room service or any of the above. So that's interesting. I think that what I'm hearing as a trend perhaps is that the pediatric facilities are more able to do the room service model for all, and these other facilities that have more adults and mixtures of different populations, maybe they're needing to have some of these other meal delivery models for those who aren't able to participate in the room service, and specific populations like you mentioned, Jose, around where the food is part of their treatment, like with anorexia and bulimia, they're not able to participate. We did have a question. Do any of the room service sites surveyed have over 500 acute care beds? And the largest facility was Marianne's with 430 beds. And smallest was CHIO with Bernice Wolf, had responded with 120 beds. So that was really the range from 120 to 430. Just looking at the respondents. So Covenant responded with 300. Andrea, yours was about 300. And Jose about 420, just to get a sense of the size of the hospitals. And in BC, the other respondent we had on our survey was 150 beds. Right, next question, which everyone I think is just totally anticipating.
This is the one. Okay, so we'd like to ask our panelists, what was, the approach to evaluation? What data did you capture pre and post implementation, and what did it tell you? So we'll follow our order, and Andrea, you're up first.
Sure. So I hate to be repetitive,
That's okay.
Yeah, we really looked at plate waste as being an indicator, one, not only to the success of the food, but the patient satisfaction. It was really kind of neat because we knew it worked, and we had won our employees over because we had one of our dish room people collecting trays for the first time after we just launched, and he brought them back to the dish room and said, look, it actually works. There's no food on the plates. And he called all the employees over to take a look and see, like, oh my gosh, like, we did it. So 1, plate waste, and 2, patient satisfaction. So those were the 2 really big measures for us. And I know the person who was before me obviously looked at financials and did all that fun stuff, but really was focused on the patients and what their satisfaction would be.
Hi, sorry, it's Carol here, and I'm madly trying to come up with the, we just got our final patient satisfaction survey results, and unfortunately my spreadsheet hasn't calculated the overall satisfaction correctly. So I don't know, Kelly, if you want to just add those numbers together, and then I can get that. Sorry, I'm just going to get that for you. But just to let you know, obviously we're using the same survey throughout Alberta, the same one that Alberta Health Services uses for patient satisfaction. So one of our keys was to bring those results up. And I'm happy to say that overall that's happened. Our variety has increased from a score of 70 to 84%. And I have a bit of a story around variety because that's been an interesting one for us. Taste, we've increased from 63 to 73%. Our temperature has remained the same, around the mid-50s. And we know that that's one of our issues. Again, I'll stress we just went live in May, and we are finding that it's taking us 60 minutes to get trays up to patients versus the 45 guaranteed. And so that's one of the issues that we are looking at now. What are the barriers to reaching that timeline? And I think if we can get our timelines to that 45 minutes, that will address our temperature issue. Appearance, we jumped from 72 to 83%. Our service is probably our biggest one. We've gone from 84 to 92, and we know consistently on the comments we get that's the #1 thing that our patients love about the new system is having our ambassadors on the floors, having that service, that ability to deal with an issue right when it happens. And I'm just trying to get a number here.
I can't, I don't have good eyesight.
Okay, sorry, Kelly's just working at that. But we know we've had a significant jump. We were 5, then I'll post it. Like from there.
Oh, okay.
We were sitting at a 57% before, and I can tell right now the number is significant here in terms of the jump of overall satisfaction. So we're just trying to get you that answer here.
Oh.
We've also done a plate waste study, and that's been completed. Again, we found a significant, we were sitting at over a 50% plate waste before we went live. We are down closer in the 25 to 30% range, depending on when you look at the waste. The interesting piece of that is that what we're finding is we still have a group of plate trays coming down untouched. And if we could deal with that issue happening, we would probably see our plate waste fall under 10%. We have also, you know, again, because we're new at this, we're trying to figure out what's going on. And one of the issues we're finding is that our ambassadors have a really hard time accepting that somebody's not ordering a meal. And so we are really working with training them that it's okay if somebody doesn't want to order a meal. And so what I think is happening to some extent is that we are getting trays being ordered because people feel like they need to order something when it's okay if they wake up and they don't want their breakfast. So I think there was a lot of pressure from the care staff when we first started to ensure that everybody had a meal. And what we're finding is that the ambassadors have taken that on and are maybe sending up trays that don't need to be sent. So we're working on that one. So Kelly has just magically given me the numbers. So we were sitting overall at 57% and we've jumped to 86. And that is in a 4 or 5 month period. Mm-hmm. We are also obviously looking at the financial metrics, and we're just looking at that right now. We wanted to ensure that the goal for this was that our food costs would go down to cover our increase in staffing costs. I will be honest with you, we don't have our staffing costs in line and where they need to be, and so that is something we are continually working on, although our food costs and waste are going down. We are also wanting to look at our overall costs in our dish room and what the costing was of our supplies for the dish room pre and post implementation, and we just don't have those numbers yet. So that's what I can share with you at this point in time, and as we get more information, I know Michelle will bring it forward to the cohort.
For St. Justin, what we have for data, the satisfaction, we start in 1911, we were at 50. 1912, we jump at 60% of satisfaction. And after the room service, we are now at 97. So it was really, really more than what we were. And we are really happy about that. Second thing, it's about waste. So as I said before, we had 25% of our meal untouched, and now we have around 5% of all the food in the plate that we put in the garbage. So it's mean for us that everything is heat in the plate, in the plate. We also evaluate the number of meals that we deliver. Before we were around 140, 150 per meal, and now we deliver patient. We don't talk about parent or people who pay for it. So we are around 130. So it's mean for us that we have a reduction of 20 or 30 plate per meal. Because before we deliver meal and they don't eat it. So for us, it's mean for us that we save dishes to wash, food in the garbage. So it's mean money by the same time. We evaluate the time that the people are by phone to wait, you know, before they give their order. So the average, it's about 2 minutes you know, during the rushing time. So it's mean that for the waiting, to wait, it's about 2 minutes. So for us, we have to reduce that, but I think it's good. We were happy to hear that. If we talk about saving money, because for us it was important, it was a non-negotiable way. When we choose the room service, it was important that it was in the plan. So we reduce money. The problem that I have is we did 2 major change when we start the room service. We start the room service in January, and in April we take all the restoration in the hospital. And those 2 things means for us that we reduce of $500,000 of the expense of all the service. So where it come from? It come from those 2 change, but we save money with that. And oh, that's it.
Okay, I'll do Marianne's, and then we'll circle back to the questions that were posed and see whether or not we've answered those. So again, like everyone else, patient satisfaction scores, looks like overall there was an increase from 65 to 70. They were at 65 to 70%, I'm sorry. And then following the implementation, it looks like they are sitting closer to 90 to 95%, with patients enjoying particularly the variety, the ability to choose, order when they wanted, and as we've spoken of multiple times during this session, the whole sense of control. So we're just going to circle back to the questions that were posed. Carlotta, have we answered those?
I think we have. Yeah, panelists have spoken to the cost savings that have been realized or not, and how dramatic improvements that they've seen around patient satisfaction. Really impressive results.
Great. All right, so that's going to take us to our last question. And so
Danielle, there was one other question that I got in French, which was just whether Andrea could clarify the number of beds in her province. Jose was just indicating that the number of beds wasn't a limitation to where room service could be offered, and she's referencing an example in Quebec where the CHUM had more than 500 beds and was able to do a hybrid service.
Sorry, you're looking for a clarification on the number of beds in the province?
Est-ce que c'était ça, José? Was that it? You wanted to know that?
Because, Andrea, you said that a lot of hospitals in your province offer the room service. Is it all hospital in the same size of patient of your, or you have bigger or smaller hospital?
So they are various. So the IWK, which is the site that I'm at right now, is 300 beds, but there are larger sites as well. But what those numbers exactly are, I'm not sure, because there's about how many different sites? Quite a few sites.
I'm asking that just to say to people with us today that the number of beds is not necessarily an issue. It's just why I'm asking you this question.
Yeah,
has Capital Health moved forward with the Dial for, sorry, I have to remember the name for the Dial for Dining program? Capital Health will be one of the largest facilities, right?
So Capital Health is referring to all of the hospitals in Nova Scotia with exception to IWK.
Oh, I was thinking, what is the big hospital in Halifax?
So you're probably thinking of Victoria General.
Okay, yes, that one.
Or the HI. Yeah, they're transitioning right now. Yeah, so they're in the midst of transition. I think the only thing I could comment on, just if I could give anyone a piece of advice, IWK is a 24-hour operation. So right now, I think that is our biggest challenge. We don't get a lot of patient meals overnight. And that takes away from one of your staff members being able to service your higher volumes during the day. So that is my little takeaway from our Delphi dining. We didn't start originally 24-hour, but we implemented it later on.
Perfect. You actually just started perfect time in terms of thinking that the next question is really what would you do differently? So if you were going back and redo the process, what is the one thing you'd want to tell all of us to make sure we did it differently or to make the process smoother? Is there anything else, Andrea, that you would do differently?
Yes, actually. I would love to have pods on every patient unit. That would just make it so much more quicker for the patients to get their meals. 40 minutes is, I don't think, a long time to wait, but if we could be that much quicker and have our staff reduce their footprint around the hospital, I mean, that would be really ideal.
It's Carol here. So I hope I'm allowed to have two things here.
Sure, two things, great.
So the first one is, and we did engage nursing, because of the process that we used, we got maybe a bit behind and pressured in terms of getting processes in place, and so there was a bit of sort of, you know, last minute angst. And so I would just say engage nursing really early and really start working through those processes as quickly as you can, because you really want that in place a good, you know, month or two before you go live, so everybody can be really confident in them before you go live. And the other thing, and I'm almost embarrassed to say this because as a food service person I should know this, but I really wish that first week we had sent up trays of sandwiches, etc., to make sure that there was food on the floor for the mistakes that are going to get made that first week or two when you're going live and everybody's relearning their jobs. So just make sure that your units have food and backup for that missed tray, etc., just to keep everybody happy. Just good customer service.
Okay, thanks. And Jose?
For us, when we start, we put more employees than we were supposed to do on a regular basis, and I think it's really important to have that. As the person before me said, for our employee, it's a really different way to work. So everything is longer. So we need to have more people to be sure that we could deliver the meal in a good time to the patient. For us, the time was really important. We asked that we serve before 45 minutes or instead 1 hour, and we were able to do it because we are a big team. And after a few days, we reduce, and after 2 weeks, we were the regular staff, and it was fantastic that it could be like that. If I could change something, I would say that when our menu is really, really, we have a lot of possibility. We have we have a pasta bar, a pizza bar, a stir-fry bar, a salad bar, a sandwich bar. So it means that we have a lot of food to prepare before, you know, to portioning things. And we do too much, and we realize after that it's not necessary to portion frozen vegetable and a lot of things, and it was hard for our people to portion everything. So I think we learn about that. We love our menu, we don't want to change it, but we was a little bit crazy about what we have to pre-portion before the meal. So it's the only thing I could change in that type of service.
Great, thanks. So we're out of time, so I'll just really highlight that Marianne described that things worked really well, but a key learning that went well, but why it went so well is because they did the changes before they moved to the new facility. So she thought that was really important. So if you're thinking about doing room service in a new facility, try to do it ahead of time. It was a key message that she had. But lots of things that they did to make sure it went smoothly. So because we're out of time, I think we need to conclude. And unfortunately, we didn't have time for more Q&A. I know we could be talking about this for the next hour, I'm sure, with all the things that we want to learn. But I just really want to thank all the panelists for your support. And everyone who completed the survey, and then today for spending more time and helping us to understand more in depth these questions. Really appreciate the time that you put in to who we call ourselves. We have the givers and receivers. We're just so excited about room service and really appreciative of your time that and information that you've shared to help us do it successfully as we start on this journey and thinking about room service at our facilities.
A big thanks to both of you as well, to Danielle and Carlotta, for pulling this work together. It's really impressive to see the evolution since that first giver taker discussion. So thanks to you both for everything that went into this. It's wonderful.
Well, thank you. And if there are any questions, my email address is at the bottom. If you'd like a more complete copy of the survey results, please let me know. With that, I'll just check one more time in the chat.
And if you want to share this presentation, remember it is being recorded for those who could attend.
All right.
Thank you.
Thank you, everyone. Have a wonderful day. Merci, José.
Bye.
Thank you.